Good morning. My name is Komal Ankush. Today I will talk about the pharmacology of drug. A medication or medicine is a drug taken to cure ameliorate any symptoms of an illness or medical condition. The use may also be as a preventive medicine that has features, benefits, but does not treat any existing or pressure existing disease or symptoms. Dispensing of medication is often regulated by governments into three categories: existing over-the-counter medication which are available in pharmacies and supermarkets without special restriction, behind-the-counter medicines which are dispensed by pharmacists without needing a doctor prescription, and prescription-only medicines which must be prescribed by a licensed medical professional, usually a physician. In the in the United Kingdom, behind-the-counter medicines are called pharmacy medicines, which can only be sold in registered pharmacies by or under supervision of a pharmacist. These medications are designed by the letter P on the label. The range of medicines available without a prescription varies from country to country. Medications are typically produced by pharmaceutical companies and are often patented to give the developer medication exclusive rights to produce them. Thus, that are not patented or with expired patent are called generic drugs, since they can be produced by other companies without restriction or license from the patent holder. Pharmaceutical drugs are usually categorized into drug classes. A group of drugs will share a similar chemical structure or have the same mechanism of action, the same related mode of action, or target the same illness or relatedness illness. The anatomical therapeutic chemical classification system, the most widely used drug classification system, assign drugs a unique ATC code with is a alphanumeric code that assigns it to specific drug classes within the ATC system. Another major classification system is the biopharmaceutics classification system. These group drugs according to their solubility and permeability or absorption properties. Some religions, particularly ethnic religions, are based completely on the use of certain drugs known as entheogens, which are mostly hallucinogens, um, dissociatives, delirants. Some drugs used entheogens include kava, which can act as a stimulant, sedative, or euphoriant as an anesthetic. The roots of the kava plant are used to produce a drink which is consumed throughout the culture of Pacific Ocean. Some shamans from different cultures are enthusiasts defined generating the divine within. To achieve religious ecstasy, Amazonian shamans the hallucinogens brief for their purpose. Smart drugs and designer drugs. Nootropics, also commonly referred to as smart drugs, are drugs that are claimed to improve human cognitive abilities, are used to improve memory, concentration through mood and learning, and increasingly used nootropics among students, also known as study drug, is methylphenidate, branded commonly as Ritalin, and used for the treatment of attention deficit hyperactivity disorder and narcolepsy at high doses. Methylphenidate can become highly addictive. Serious addiction can lead to psychosis and anxiety and heart problems, and the use of the drug is related to rise in suicides and overdoses. Evidence for use of outside of student setting is limited, but suggests that its compliance. Intravenous use methylphenidate can lead to damage to the lungs known as Ritalin lungs. Other drugs known as designer drugs are produced. An early example of what today would be labeled a designer drug was LSD, which was synthesized from ergot. Other examples include analogs of performance enhancing drugs such as designer steroids take to improve physical capabilities, and these are sometimes used this purpose, often by professional athletes. Other designer drugs mimics the effect of psychoactive drugs. Since that the late 1990s, there has been the often identification of many of these synthesized drugs.